All right, everybody. Happy St. Patrick's Day. Now, we can't regale about all our previous St. Patrick's Day celebrations, given the nature of some of the content in this committee, but we can wish each other happy corned beef and something.
Right.
Cabbage and it's waiting for me.
The last rendition I had of that was just so,
I made it.
it can be done well and it can be done very good. All right, starting us off, Commissioner Gibson, DSS.
Hello,
We
Bob.
continue to have people shift gears down there.
Thank you, thank you. All right, first request today to fill one social welfare examiner position.
Second, okay, further discussion, all in favor?
Aye.
Opposed, carried.
All these positions that I'll be requesting, I did talk with the point one committee about. Second request is to fill one income maintenance staff development manager.
I'll move this one.
Hold on, we
Wait a
got a
minute.
caseworker. Caseworkers were before.
Really?
Actually, that one that you had, the first one you had, Kelly, I think in the second line, it
Yeah.
said,
I think it was, yeah.
it was, the description he was saying was,
You know what? Hold on 1 second, guys.
Mhm.
The next one above it, Health and Human Services agenda.
Yeah, no, that's just the small agenda, I believe, yeah. Cause it's almost like it was, that's the prior month, right? It's just social welfare. Maybe they just had an order. All right, so the first one was social welfare examiner, right? And then we have a caseworker.
oh yeah,
And
this
create
is,
and fill
right, it says the
income
income
maintenance.
maintenance,
Okay,
yeah.
sorry, guys.
Yeah,
I only saw it was caseworker and I was like, uh-oh.
Yeah, yeah.
Okay.
So I did move that
I'll
one.
Pretty off
second it.
kilter.
any further discussion? All in favor?
Aye.
Opposed? Carried. Now, is this gonna help do the 6-month, like SNAP re-registration as opposed to the annual? Is
It's
that
gonna get us on our way. You know,
Okay.
we're gonna- This is a good step forward for sure. Yeah, start retaining some staff as well. And with that comes the abolition of one caseworker calendar. That's probably what I saw.
Yeah.
Okay, number 3, request to create and fill one services staff development manager
Yeah.
and to abolish one caseworker position simultaneously.
Yeah, that's it.
That's it, okay.
I'll move it.
Second.
Further discussion? All in favor?
Wow.
Opposed? Carried.
All right, number 4, request to fill 2 caseworker positions.
This is one and then there's another one on that.
I'll move both of them.
Dave moved.
Are you willing to second both?
Yeah.
No, terrific. Further discussion on both resolutions? All in favor?
Aye.
Opposed? Carried.
Request, number 5, request authorization to fill 1 senior caseworker position.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Okay, number 6, request authorization to fill 1 assistant social services attorney position.
No.
Do I have a motion?
Move it. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Number 7, request authorization to enter into a contract with Patricia O'Neill for the provision of mental health consultations with the department employees as needed.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Very good. There are the numbers. Know that I have anything else to really report on, other than that this month. We're still trying to staff up, as you can see. We're still trying to lawyers, as you can see, very difficult to
He
do.
made the new organization that was trying to bring new recruits to the counties. In the news that Columbia County was looking for DSS attorneys. Good for you. Yeah. I don't know if the program will work, but we'll see. You gotta try something.
How's the warming center been this last month? Is
Very
it-
good, yeah, very
Phil?
good. Yeah, actually, I've been pleased all year with the services we're receiving over there. I think they've done quite an excellent job this year. That looks like it really looks like it can be a long-term, partnership there. So, yeah, very pleased with it.
All right, any further questions for Commissioner Gibson?
All right,
Thank you, sir.
all.
We have an Irish director coming up, right? Yes, ma'am.
How's everybody? Sweater too, I love that.
Thank you very much.
Yes, yeah.
My first request is authorization to contract with Kids Enchanted Speech Language Therapy.
I'll move that.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
All right. And next, requesting authorization to enter into an MOU with Columbia Green Addiction Coalition to use our dual settlement funds towards a survey conducted by Siena Research Institute, measuring attitudes, behaviors, particular to addiction, vaping, nicotine.
When I first read it, I thought the whole allocation was gonna go.
No,
to
no,
the
no, no,
survey, and I
it's-
said,
it's-
wow, this better be an impressive.
What's the dollar? Okay, I'll move it.
So yeah, it's $7,000. And there's gonna be 3 contributors towards
I
that.
know.
I had a motion. Do I have a second?
Right here.
All in favor?
Aye.
Is
Opposed?
there plans for the rest of the dual funding?
So we have a couple things lined up. One of our activities is going to be training for medical providers, and we're working right now on getting CMEs for that training. So it's a bit of a process to put it all together, but it is going to be both counties working on that with our partners at St. Peter's.
Good.
So the numbers are going up for kids vaping and smoking again. That's
So
all.
we're going to look at exactly that. Yeah.
And that's a one-time settlement, or is that a settlement that has a multi-year factor to it?
So the total is, that's the total that we'll receive. We've gotten, I think,
Okay.
2 payments, so a couple of years worth of payments, to reach that.
Thank you.
Sure. The next request is authorization to surplus equipment or, a repeater, which is quite old and not being used.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And I think this might be the final request, and that is for authorization to revise the environmental health fee schedule.
I'll move that.
I second it.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Then I have my director's report for the month of February. The month of February, we saw a lot of respiratory illness. It was still raging. We're hoping that we're starting to see the end of that now in March. But it was brutal.
We've all had it, like you
Yeah.
in the building.
Mhm.
Run around.
Takes her out, so
We
I
are.
just pulled one off my shoulder as I walked in the door.
I thought they would all froze this winter,
I
but,
I would have thought so too. My
You know,
poor dog
the snow, the amount of snow we've had, it creates like an
Insulated.
insulation for them. It's like, you know what, all this for nothing.
Yeah.
Nothing.
is-
That's
Yeah, we dealt with all.
not even that
all
one
that.
per,
Had no effect on them whatsoever. Yeah,
it's
it's,
so unfortunate,
yeah, my poor dog had.
you know.
just-
Yeah.
All right.
Correct.
Yes, unless you have any any other questions?
I will make note of the Board of Health meeting, Director Ursul, I forget the finance.
Brian Mahoney is the
Yep.
CFO and Dorothy Urschel is CEO.
We're willing to come out and address the Board of Health, which is a great thing, their continued involvement with the local community as far as their plans and the goings on in the hospital.
Yeah.
Great.
A lot of our board members did have some questions and they answered, and so it was a really good, opportunity. I think I'd agree. Yeah.
How'd you make out with the contracts for your?
They are fully executed. So we've gotten 37 of our, plans that are in our queue in front of engineers. So, you know, it is still a lot of work on our end. Unfortunately, it would have been really nice to do this and then, you know, but, it's still a lot of back and forth. So, we'll have to see how that turns out, but part of the increase of the fee schedule was to compensate for those contract, relationships.
Yeah.
And our code,
Prices have gone up since 2013.
so our code officer said that his calls have been reduced by half since,
Oh, good.
yeah. We had a lot of outstanding.
Yes, there were a lot, and we had a heavy queue for sure, and I'm very hopeful that that will be taken care of.
Good.
Yeah, the number of contractors and excavators that approached me, said, what's going on in your town? They got
Right.
reduced by half at least.
Yeah.
Good. Yeah, our phone calls are getting better too. So thank you all for the burn that you shouldered on our
Yeah.
back for that too.
And I have one more question as we get towards the spring. How was our vaccination program? What was how would you address vaccination hesitancy that we've seen this year? I mean,
So the news today is interesting. The courts that have, you know, the certain things about how the ACIP has been handled. I hope that some of that is figured out by the time fall gets here, but I'm not all that, sure that it will. So we'll kind of see how that goes. You know, it's difficult to make one sweeping recommendation for everyone, but our responsibility as a community is to protect each other, and our responsibility to be in community spaces is to protect each other. And so the most straightforward, easiest way to do that is vaccination.
I'll never forget, I had a large animal vet years ago who said, whoever vaccinates the most wins.
So,
Right.
so don't refresh my memory. It's coming up on summer camp time.
It is.
Do we have did we ever affect an agreement where camp counselors had to be vaccinated for measles? Because I've seen a number of measles outbreaks recently.
Yeah. It did not impact there was no mandate for the camp counselors. It's strongly advised, and we have a very good relationship with our camps, that they know that we really prefer that, and we really, you know, as regulated entities, it's,
You want your operating permit.
Well, they-
well, you know, it's not like, you know,
But,
it's,
but based on their experience a couple of years ago, we had those two outbreaks.
Right.
I think they
Right.
would have learned
Right.
from it.
Yeah.
and without it being mandated, the lesson was learned, I think.
Being done now.
Yeah, and that, you know, not that we can give preference to anybody or that we can make anyone's life more difficult, nor would we, but you know,
Your preferred statement.
yes.
Yeah.
You guys are asking me hard questions today.
Yeah,
That's a very diplomatic response. I
I
appreciate
tried.
navigating those dangerous
Yeah, I
waters.
have, personal opinions that we can talk about in another time, but yeah.
All right, thank you, Director. Any further questions for
Thank you so
Director
much.
again? Thank you very much. Director Almasi, Human Services.
Good afternoon, everybody. Good to see all of you. Happy St. Patrick's Day. We're starting with the general or the personnel?
This is the general.
Okay. In that case, there's a total of 4 general resolutions that I bring before you today. The first of which is expanding our community services board with 2 new members, one being a chairperson, another person coming from the subcommittee to the CSB. So I ask for your support.
Second,
Further discussion?
I just was curious why it's been vacant for several years.
No, that's okay. I'll gladly speak to that. simply put, a challenge to find an interested individual to serve in the chair position. We recently recruited an individual to guide us through a retreat and kind of recalibrated where we felt the CSB should be, what we expect of a chairperson, what the different roles should be, and how the CSB should function in a sort of deeper way than what the mental hygiene law dictates. And that was very helpful. And as a result of that, an individual came forward and expressed an interest who was appropriate, met the minimum criteria, and then some. And I'm happy to say that's Amanda Pirro. I look forward to working with her as the Director of Community Services. Yes.
Excellent. And we thank both individuals for stepping forward.
Yes.
All in favor?
Aye.
Opposed? Carried.
Second general resolution is quite simply your support for a letter of agreement between Department of Human Services and Four Winds. They asked for this. It's just a regular understanding of an MOA.
Do I have a second?
Second.
Further discussion? All in favor? Aye. Opposed? Carried.
Third resolution is to continue to contract with one of our psychiatrists, Dr. Khan. She'd like to work with us for another year. We'd certainly like to have her work with us for another year. So I ask you for your support in that relationship.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Now, being that our admitted cases are slowly but steadily on the rise, our prescribers are at capacity. So we have a nurse practitioner who's currently with us for 14 hours. I've spoken to her and she's been agreeable to increase by 7 hours. So I ask you for your support to increase her from 14 hours to 21 hours so that we can meet the current need of prescriber hours.
Move it.
Do I have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And then the last resolution is a personnel resolution. Your support to create and fill a new title to the Department of Human Services, Senior Behavioral Health Care Coordinator Specialist. It's a mouthful. I didn't name it, but it's a lot. What this will do is assist the program supervisor. It'll be their right-hand person, so to speak, for adult care coordination. Adult care coordination has grown significantly over the years. The need is still very much out there in terms of this service. It's a Medicaid-based service. Fortunately, it's not been detrimentally affected as of yet, nor do I believe it will be as a result of some of the federal adjustments, I'll call them, to Medicaid. I guess important this as an aside, this program brings $1.2 million to the department annually and covers its cost by maybe $100,000 or close to $200,000. So it's breaking even and slightly then some.
And it's been vetted by point one?
Yes, absolutely.
This is replacing the psychiatric social worker position, correct?
No,
No?
the psychiatric social worker is the program supervisor. This would be their
Okay.
number two. And I will make note in this resolution, we're asking for the support that there be kind of a domino effect type backfill process because this will be promotional. So there are two individuals that are eligible to be interviewed for this new position. Those are senior behavioral health care coordinators, not specialists like this title. So they would interview. That of course would create a vacancy, and then behavioral health care coordinators would be eligible for that. They want to backfill so that we can maintain.
We actually stopped backfills. So you'd have to come back to the committee.
Okay, for each and every one?
Yep.
That's why I'm bringing it up because I didn't remember that, to be honest. We weren't sure. We were speaking internally. So I'm bringing that to your attention. So thank you for that, Chairman. I'm happy to do that, but we want to just maintain our ability to generate the revenue that we've been generating by backfilling. So I'll present my case situationally.
Okay.
But because it's not budget, it will be budget neutral, let's per se, with revenues.
Right. Right. All these positions generate revenue.
Yep.
Do they see clients?
Yes. Yes. Including this position. Yes. This position will cover its cost 60% or so with revenue through seeing clients.
Did you have a motion?
No.
I'll move it.
Do I have a second?
Right here.
Move it as revised, correct?
Right.
Oh, to eliminate the backfill.
We had to come back to 21.
Okay, I had a motion on the revision and I had a second. All in favor?
Aye.
Opposed? Carried.
So I shared with Kelly, who then shared with all of you, director's report. I'm happy to go through some of the highlights or entertain questions or curiosities about some of the things that I included.
Can you talk about the Oxford House and, since its implementation, how's that done? And Greene County was looking to
They,
establish.
they have one, yes.
Yeah.
So currently we have two Oxford houses, one in Columbia and one in Greene. The Oxford House in Columbia County is doing well. They've had two different coordinators, three different coordinators. Current coordinator seems very invested, involved, curious, immersing himself in the local behavioral fabric, attending meetings, doing the right thing so that, you know, we can all get to know him and cultivate the relationships so that the referrals start happening. The house, at the time I wrote this report, I believe had 2 vacancies. Just as a reminder to the supervisors, it's including the coordinator that lives in the house, it's 8 beds. So I think they had 6 in the house with 2 vacant beds. That may have changed. That's something that, you know, we're always trying to keep a full house, but, you know, it's a goal, but not always achievable. But in terms of its impact for those that are living there, it's what we expected. It's very powerful. I went out to the house, got out to the house, excuse me, a few times, spoken to them. They like it. They enjoy it. It's been well received.
Thanks.
I just had a question about the Breezy RFP. We were also just at the New York Counties Association, New York State Counties
Yes.
Association. Yeah, about like, it sounds like a lot of the money is left on the table every year for Raise the Age. Anyway, so I'm just curious, like how much they're going for, and is the Safe Spaces program the clubhouses? I know there's a
The youth,
clubhouse
yeah.
program.
So the entry here regarding safe spaces for youth is an RFP, a request for proposals, put out by the New York State Office of Mental Health. It is similar in structure to the youth clubhouse, which is an RFP that was put out and continues to be put out by the Office of Addiction Supports and Services.
Okay.
So the substance abuse
Okay.
end of things.
Got it.
Now the mental health end of things is putting out an RFP of a similar sort. Mental Health Association of Columbia and Greene Counties operates our youth clubhouse, the Oasis
Yeah.
Youth Clubhouse. They are interested in going after the mental health. I think it's a nice pairing. They have to be aware of the overlaps and the boundaries of not being able to, you know, kind of cross-pollinate the two, keeping them separate per se. But I think it's an appropriate provider to be going for this. Yeah.
So would they use the same space on alternate days or?
That's what has to be sussed out, should they
Okay.
be successful. Maybe they can even use the same space on the same day, but suss out how there's different programming for the different children that are there for the different reasons.
Do you know how much they're applying for?
I don't know off the top of my head. The RFP definitely said, I can share the RFP with Kelly. You can push it out if you'd like.
Yeah.
Okay.
To Sonia's point, they were saying that this money would probably be returned to the budget, to the general fund because it was so underused.
Yeah.
So I think we're saying ask big.
Yeah.
Yeah. Oasis is really pushing the clubhouse model in the governor's budget. I think they're looking to push for the 17 or 20. I just read it earlier today. Additional clubhouses throughout the state. It's a model that really works. For those of you that aren't familiar with it, it's a place where youth can come. It's very low key. There isn't official programming, but there are staff there, of course, to guide, provide some structure. You know, make sure nothing's going on that shouldn't be going on. But it's a safe place. Children feel comfortable. They can learn. They can be educated and informed about, in the case of the youth clubhouse for substance abuse issues. But it goes way deeper than that. It's just a place where friendships can be created with the adult mentors as well as their fellow youth. It's really powerful. And Kai Hillman, who's the director for the clubhouse here in Columbia County and Greene, does a wonderful job, really wonderful job. It's remarkable. It takes a special person to work with kids, and he is that special person. I can say that.
As a corollary to that, this past weekend, Simply Woman Barrett had her Women's History event, and one of the 10 women that was honored was Lori Quinn, and the number of people spoke to the impact is not the right word, it's not big enough word, but to the, how many lives had been changed in terms of having a place and a person to go to for these kinds of services. And it was really very moving, I have to say, to see people in recovery speak so openly and wholeheartedly about something that really turned their lives around. So
It's interesting how things come full circle. You know, OMH supported a clubhouse model many, many years ago, and then they defunded it. And the people today that attended it still talk about it at the clinic, how much they appreciate it. Go there and they cook meals and, you know, hang out and play pool and just be with one another. And there was so much therapeutic value in that. But because it wasn't a Medicaid reimbursable service or through insurance companies, it was purely funded by the state, and decisions were made to defund it. And, you know, here we are now with these models kind of resurfacing and getting enthusiasm and attention because of the value that they serve and that you speak of, Supervisor Adams.
well, what was so moving is that I think is that they spoke individually and collectively of having a place to go where they could be themselves.
Right.
They could be accepted for whom they were.
Just comfortable, not have to hide it, not have to worry about stigma, bias,
Exactly.
things like that. Yeah, it's a relief.
It was, it is.
Any other questions or things you'd like me to comment on in terms of the report? I spoke a little bit about the Department of Human Services and its overall financial standing. It's a little too early to get into the nitty gritty of it, but I did give you some, you know, general kind of assessment of it, summary of it, in that we're working very efficiently. I'm extremely proud of the new cohort, I'll call it, of employees that we've onboarded over the several months, years since COVID. They're doing an amazing job of really dedicating themselves to the work, which is tough work. They're initiating groups to run groups. We didn't always have that at the clinic. Caseloads are pretty much where we need them to be. It's a tough audience to engage with, as you might imagine, and our capped appointment status is at the industry standard of 70%. It's translating into decent revenue generation. We trended $900,000 over in 2025 than we did in 2024. Granted, there was some expense with that, of course, because additional staff had to be brought on to generate that revenue, but there's still a $600,000 somewhat surplus. Now we haven't, you know, the Mineski report into that in terms of what we, you know, owe in terms of the quote unquote rent and to the different departments like human resources, paying attorney, et cetera. But it's just really good to see. And I wanted to share that with you. I'm extremely proud of my department and the employees are working very hard, and I wanted you to know that.
You know, was it the Astor group? Who had you shared space with, office space, whether
Right.
with acute, juvenile?
Home-based crisis intervention, HBCI. There are two workers from Astor Services out of Dutchess County who come in to refamiliarize yourself, because I've talked about it here before, but I know you guys hear a lot of things. Home-based crisis intervention is a very acute, targeted intervention with a youth and their family that this worker does to keep the child out of the emergency department, out of the psychiatric emergency department, and then out of an inpatient psychiatric stay whenever possible. So they come in and they offer up to 6 or 8 very concentrated sessions in the home to try to stabilize things and work with the child and the family so that the kid doesn't end up further decompensating, having to be brought to the emergency department, and then having the emergency department looking for an inpatient bed. The tragedy is that the kid often, the child, I should say, excuse me, waits in the emergency department for days, sometimes weeks, for a bed. We can all agree that that is not an appropriate place for a child to be waiting for an inpatient psychiatric bed. But since we don't have an inpatient psychiatric unit here in Columbia County, there's no other choice for that child but to sit in the emergency department. So this service is incredibly important and powerful because it diverts the child away from, in most cases, in a lot of cases, from that emergency department, having to sit there waiting for the bed. In some cases, it's unavoidable. The inpatient unit and the emergency department that gets the child to the inpatient unit is inevitable. That's what's necessary. But HBCI has been very helpful in terms of diverting kids away from that. So thank you for asking.
No, thank you. Any further questions for the director? There being none, thank you very much, sir.
Appreciate it, sir. Have a good day.
Office of the Aging, Director Benvenuto.
Hello.
I forgot it was St. Patrick's Day until I got into office. It was like, everyone's wearing the same color. I missed the memo. But I'm Italian, so you know, it's fine.
Okay.
There's green, there's green in that blanket.
That's true. Okay, so my first request for you tonight, I should also point out that I have my assistant director Kate with me today.
She's remembering.
She is wearing. Oh, yeah. She sends it every-
This is completely by accident, by the way. just so.
I'll be at a conference next month, so just in case we need to come back, I figured I'd introduce her to everyone that, you know, I know you're new, so. So the first request I have for you tonight is for approval to contract with the Columbia Green Community College to utilize their premises. We're putting together a caregiver forum in tandem with the Alzheimer's Association, the local chapter, and Greene County OFA. There's no charge for us to use the space, and if you're familiar with the PAC, is it performing? Not performing arts, professional? Yeah.
Professional, yeah.
We are going to have basically the entire first floor available to us and one room on the second floor to be able to provide on-site respite for the event.
I'll move it.
And a
Second.
further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you. Pretty much every resolution from here on forth is about the same event. But this is just to contract with or an MOU rather, with the Alzheimer's Association for that event, where they have agreed to, provide catering for the event.
So a second, further discussion? All in favor?
Aye.
Opposed? Carried.
Same idea. This is just to partner an MOU to partner with Greene County, since both of our names will be on marketing for the event. I just wanted to make sure we're all on the same page.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you. And last one, I promise. I put 3 on this one, so I limited it at least. This is to provide on-site respite. So this is a partner or an MOU with the Social House. There's 3 separate ones. Out in Valatia, which is the only daytime respite provider in our county. Grace Place through the Resurrection Lutheran Church out in Greene County, and then Hearthstone Care, which is also out in Greene County. They've agreed to partner with us and provide volunteers along with members of our own new respite pilot to be able to provide at no cost to us or to caregivers on-site respite during the event. So
I'll move that. Second.
Second, further discussion? All in favor?
Aye.
Opposed? Carried.
thank you. And once we get a little farther along in that process, I'll have to save the date to send out for everybody. The only other things I had for you was just some quick updates. 2026 Volunteer of the Year winners. We've got Jean Engel from Ghent and Sharon Hover from Stuyvesant Falls. May 26th is the Older New Yorkers Day up in Albany, where we'll go up to the Crown Plaza and they will get their awards. I just finished typing up their stories for our upcoming newsletter that will come out in April, that I'm sure you'll all read as soon as it comes out.
You try and read it, yeah.
The stories, you know, I love interviewing the nominees, but the stories that these two have, I think they're really touching. So I'm excited to get to meet both of them and bring them up there. So definitely look out for those 2 articles.
Sharon Hooper's a wonderful woman.
Yeah, they're super,
I don't know
super
the other
sweet.
lady, but Sharon is completely fabulous.
And they do a lot. They both said, well, I'm
Generation
retired.
too.
Yeah. I'm retired. And I said, well, it doesn't sound like you're retired. You're certainly not resting.
Jeannie used to work for DMV.
Did she?
Yeah.
You know what? Yes, she did tell me
mention
that. But
I grew up with Jean. She was a sweetheart.
and Sharon Hover was, I believe, in the controller's office at like SUNY Construction Fund, something like that.
Quick sister.
So that's very exciting. I'm really actually looking forward to spending a day with those 2. We are starting April 1st. We are going to begin offering hot meals with our grab and go program. If you'll recall, back in November, we started them to just get the ball rolling as a sandwich or a salad, a cold plate, but we've actually
put all of the work into place to shift it into an actual hot meal. So the grab and go meal will be the same as the home delivered or the senior center meal. All the
Is that being
same.
received in general across the county here, grab and go, is it?
Good question. Not as much as we thought. We
Right.
are not getting as many reservations as we thought. In fact, we're not really doing it in any of the town halls anymore, although that really was in reaction to the government shutdown.
Right, yeah.
So all of our senior centers are now grab and go locations, and those are the only locations that we have. And I mean, I don't have the numbers in front of me, but I'll have them for next month for the quarterly report.
Okay, yeah.
It's not as many as you would think,
Yeah.
although the Kinderhook mayor just reached out to me last week asking about it, and I'm gonna meet with her, I think this Thursday or next, to talk more about the program. So maybe we just gotta drum up more
Get the
traction.
array audience or something.
Yeah, so people know about it.
Okay.
I do think hot
there's
meals.
because we could do our share of trying to get more information
Let
about.
people-
it,
yeah.
Just to get it out there, because it's just such a.
We
Yeah,
do an article on that, grab and go? Will we do a press release on it?
I think so.
We did a press release.
I think so. I'm also thinking, because it was a cold meal, it wasn't as enticing, and now that it's a hot meal, although we're headed into
I
warm
was gonna say,
weather.
you should have done it the other way around.
Yeah.
Right.
You're coming into summer now where the full meals might be more receptive.
Good of you to bring up that point now.
Right.
At least it started for next winter. Yeah, so I can share flyers with you, and we can spread them out to everybody, and we'll let the advisory council know tomorrow as well.
But at this point, you're at senior centers.
We'll start every one of our senior centers right now, yeah.
We'll get those unraveled.
Yeah. The recharger and new respite pilot has been going very well. We are now moving to being open every Friday at the Canaan location, which is very exciting. You know, the goal was to expand, and now the goal was to get it started. We got it started, then the goal was to expand, and now we're starting to expand
Every Friday, that's fantastic.
every Friday in Canaan.
St.
and-
James.
Guess what? I think we finally landed on, we were having discussions back and forth about the contract, and I think as of this morning, I hadn't even typed this up already. And now I can update it again. As of this morning, I believe we are going to move forward with a contract with St. James, which will be the third Monday. It's either the first or third Monday of each month.
I believe the 7th of April.
So that's probably the first Monday. Yeah.
So I know it's very early, but how much participation have you got so far?
We've got two participants that are coming each week. There are several others that have shown interest but haven't quite either finished the assessment process, yes, or they're already receiving respite at home and have shown interest in using the site, but just haven't gone to the site yet. So they're already in the system. I think that that's another program that if we can get the word out a little bit wider, and we have, I know that the town
It's
of
going out in our
Canaan,
newsletter this week.
yeah, the town
That'll
of
be
Canaan,
800 people.
New Lebanon did the
Yeah.
same thing. We're going to push advisory council to spread it, at least the northern part of the county as well. We are also continuing to push for volunteer recruitment and training, because in order to expand, you need more volunteers. So we're pushing that as well. And Kate actually had a meeting with the Rojan Library to discuss moving forward with using them as a site as well. So I hope to come forward possibly next month with an MOU to maybe get started there. So I think the more it grows, the program itself grows and is sustained, I think it will also kind of one of those, if you build it, they will come situations. I know people are talking about it. People are calling us about it.
And you had a great article, in which I haven't been able to find. I don't know who has, but 3 people have called me about it, so.
It was a very nice article. The reporter who wrote it, Barbara, sat down with her for about 2 hours talking about, you know, just the needs of older adults and the importance of respite, and she gets it, and you can tell when you read the article that she gets it. So I think that'll help.
Fantastic news.
I know, we're very excited about that. March is National Nutrition Month. I had Kelly send an invitation out to all of our advisory council members and everyone on the board. If you're interested in coming to take a tour of our kitchen, visit any of the senior centers or go along on a meal route, we would love to have you. There were specific dates that we planned for tours of the kitchen. Let us know if you're interested in a tour of the kitchen, because it gets a little crazy in there. So we wanted to do it strategically. But senior centers and meal routes are pretty much any day. And it doesn't have to just be in the month of March. I just thought it was, made sense because we're in National Nutrition Month. Coming up in May will be Older Americans Month. That is also the month that we're hoping to put together that caregiver forum. We have been invited to participate in a senior roundtable on April 10th in Valatia with the Kinderhook Mayor, Senator Hinchy, and Assemblyman Bendit. I really don't know much more information about that as of yet, but when I meet with her on, I think it's this Thursday, I'll find out more. It sounds similar to the senior resource fair that happened last year, although I can't remember when that was.
It was about the same time. It was outside the school there, right? The
Yeah.
elementary school. That's now the
town hall.
Yeah.
And I think it's in the same spot. So I would imagine it's a very similar event. Senior Day 2026. I think about it all the time, all day, every day. Preparations are underway. I just reached out to the fairgrounds to lock down a date and just get excited. I will get you a date as soon as I can. We'd love to have all of you there. And then personnel, we've had some new hires in the department. We brought on a new cook, a new site man. Well, she's not new. She was a per diem site manager and now she is full-time. And then we have 2 new per diem site managers. So we're hoping to be able to maybe actually open up in locations like Greenport that was interested, but we couldn't find a volunteer for. So now that we've got a little more team behind us, I think we might actually be able to do that. We're currently interviewing for the administrative assistant and still no real interest in the per diem personal care aide posting, which has kind of been a trend. So those are my updates for you.
Well, you guys knocked 2025 Senior Day out of the park. So if that's any basis, I think it'll be a
I
fantastic.
think that's why I think about it all the time.
How do I get better, right?
And from what we've had more vendors reach out asking to be added to the list. So our little vendor tent is now rapidly becoming a vendor village. I
And have to start calling it Opa Palooza
Yeah.
pretty soon.
I think we're gonna take on even more, not a lot more, but we'll be big. So get thinking about it. I'll let you know when the save the date comes out.
All right, all great news. Thank you, Director. Any questions for Dr. Benvenuto? Beautiful work.
Thank you.
Anything else from the committee? Anything from the public? There being none, I'm gonna ask for a motion to adjourn.
So moved.
So, a second? All in favor?
Aye.
All right, everyone. I'd like to call the March 17th Public Safety Committee meeting to order. Happy St. Patrick's Day, everyone. This is not on purpose. This was strictly by accident that I'm wearing green, but I'm representing. First up, we have a presentation by 911 Director Johnson.
Thank you. So I recently was invited to the LEPC meeting and asked to do a presentation on our department. Kelly was there. And thought that it might be beneficial if I do it here for you as well, so.
Very informative.
So this is our staffing structure. We have 4 shift supervisors. We currently have 6 emergency dispatchers, 2 in training, and some part-time dispatchers. Next slide. That's just our departmental structure. Next slide. Our application process. So we require a 10-page employment application to be completed. They have to pass a typing test, complete a background investigation, search of local law enforcement records, mental health, PCGS fingerprinting. We require them to agree to take a polygraph if we think we need to put them through one. Psychological examination. This is all New York State requirements of a 911 dispatcher. Police dispatchers, fire dispatchers, just ambulance dispatchers, they don't have to do this. In New York State, 911 dispatchers do. Drug testing, hearing testing, and a medical exam. And that's a long process. It takes a long time to onboard people now.
think I failed that screening, actually, no.
A lot of the current dispatchers are glad that they didn't have to go through the site exam, but the process to become an I-1 dispatcher, pass a civil service exam or be accepted through New York Helps. 6 to 8 months of on-the-job training, that's light. That's the way it used to be. It's more than that now. It's probably 8 to 10. CPR certification, NIMS training, that's ICS. So an I-1 dispatcher is required to have ICS 100, 200, 700, and 800. They have to be, we require them to be advanced emergency medical dispatch certified. So that's the old flip cards. It's now a computer system, but so that they're able to provide medical advice to callers. And we also require them to complete a basic and an advanced public safety dispatcher course. Next slide. That's just a look at some of the stuff at the 40-hour basic. The state requires 40-hour basic. We take it a step further and send them to the 40-hour advanced as well. Next slide. And that's the focus of the advanced training. Some of the more challenging situations. Next slide. Additional certifications that some of our staff had, any of our trainers, they have to be, state requires them to be certified training officers. We do have 4 or 5 TERT responders. They are people, they're dispatchers who receive special training to be deployed to disaster areas, and they can be deployed anywhere in the country, really. We do have 2 TERT team leaders that would be available to go if we do deploy a TERT team. Any of our shift supervisors required to be certified communication center supervisors. We have a couple tactical dispatchers certified to help in the field if need arises. And anyone who reviews quality assurance for us has to be certified EMDQ. This is all new as of February of last year. So it's gonna be expensive to maintain all those certifications. But we're really ahead of the curve. We already have most of them in Columbia County, so we're lucky in that regard. 21 hours of continuing education every year in those areas. We have to recertify our EMD and CPR. So it's just our shift configurations. We do work 12-hour shifts. A-line is the night shift, 7P to 7A. Day shift is 7A to 7P. And then we have that mixed 10A to 10P. Next slide. We dispatch 4 rescue squads, plus we quarterback the county EMS system, moving all the ambulances around, repositioning them and whatnot. The 30 volunteer fire departments, we dispatch 6 police departments and a host of other agencies listed there. Next slide. We answer 21 phone lines. We have 16 911 lines, 3 10-digit business lines, and 2 administrative lines, and we're minimum staffed at 2. So you have 2 people sitting responsible for that.
Answering 21 lines.
In addition, so that can be challenging. There's last year's statistics. We answered about 40,000 incoming phone calls. Next slide. Some random statistics. 81% of our 911 calls were wireless cell phones. Average answer time is 4.77 seconds. 96.4 of our 911 calls are answered in less than 10 seconds. That beats the state standard of 90%. Our average processing time is 2 minutes and 19 seconds. And 1,854 calls were abandoned before they even hit our 911 center. And what they are is Apple Watches, people with their phones in their pockets, stuff like that. There's our incidents dispatch broken down by type for 2025. So you see we're pretty EMS heavy. Spot. That's our county emergency communications network. It's a 9-site network. We added those 3 sites last year, Chatham, Gallatin, and New Lebanon. That's a look at the Gallatin Tower. That's at the transfer station down there. That's all. That was completely granted or funded with grant funds. So in addition to the basic 911 technology that any 911 center has, we have several what we call over-the-top technologies. One of them is Rapid SOS. So the old school way of locating a 911 caller is by triangulating cell phone towers. It can be highly inaccurate, and it can take you a while to do it. Sometimes you have to keep what we call rebidding and sending signals out of the phone to try to get it to. Rapid SOS, think of that as technology that like Domino's uses. You can track the pizza from their business right to your door. You can watch the driver. That's what Rapid SOS is. We can see right where the 911 caller is. In addition to the location, it will send us any medical information or emergency contact information that's stored in the phone. So like iPhones, I don't know about Droids, I don't use a Droid, but you can store emergency contacts and your health information. That'll push that straight to 911 if you ever activate 911. Prepared Live. So it provides us with a host of services, two-way texting. So we can initiate an outbound text to a first responder, to a caller. Right after we went live with Prepared Live probably 5 years ago. It was like 2 days after we went live with it, a woman called and said her daughter was being beaten by her significant other. She didn't know the address. She knew the general area of her daughter lived in, but she didn't know the address. So the call taker called the woman and she just answered and said, I can't talk. And she hung up. So they initiated outbound text and she immediately texted the location that she was at and the entire area of the text. The call taker could have also hit video. So Prepared Live Video does is we can send an outbound text to the caller. They have to approve it. But if they click on the link and approve it, it turns their camera on for us. So we can see what's going on in any situation. We can turn the camera
Good
around,
evidence to record.
forward facing, rear facing. The call taker has the ability to blur it if it's becoming too graphic. And they don't want to see it. It'll still record, but they can blur it. It also does real-time transcription for us. So this is a neat tool that the staff really loves. What it does is an AI tool, an AI bot transcribes the audio in real time, and we'll see this in the next slides. In real time, it's transcribing what's being said by the call taker and the caller. That's handy sometimes when maybe you don't understand the caller, but the AI bot did. You can look and see what the caller should, especially if they have broken language. Sometimes the AI bot picks it up better than a human ear. Or historical, you want to say, oh, did they say that there was any weapons? You can scroll up and look at the answers to that. Supervisors can hop in mid conversation and just start reading what was going on the call.
Could it translate if they're not an English speaker?
Yep. So the next line, real-time translation. At any point in the call, if the caller can't understand the language, you don't even have to know what the language is. You can just click a button. You can pick what language, but there's also the option to say, I forgot what it says, but it says unknown language or something. And the AI bot just starts listening, determines the language, and starts transcribing to us in English and to them in the language they're speaking. So that the staff love that. It also has an assistive AI keyword detection component to it where, like I have it set up right now to detect the keyword overdose. If the system detects an overdose, it'll notify me right now. That's just how I have it set up. And the first time I used that, I had set it up going home. I was eating dinner and I got a notification on my phone and it said overdose detected. And it'll tell you the sentence the caller said, and it said something like my husband overdosed or something. But I thought to myself, I haven't heard any dispatch on the scanner. So I thought this thing's going to be a piece of crap. Like it must have misheard something. And about 40 seconds later, you heard the dispatch on the scanner. So it was instant that it notified me that it heard a keyword. So you imagine scenarios like you could program it to say anytime it hears active shooter, it notifies all off-duty staff. It can notify command staff, however you program it. I can program it. I don't need this, and I'm not making that up. I do not need this. But I could program it to notify me anytime a call taker swears at a caller. It can differentiate between the caller swearing and the call taker swearing, things like that. So it's real handy. Next slide. That's a look at the Prepared Live dashboard. So on the left there is the list of incidents that are currently in progress. In the center would be where it's transcribing. On the right is the mapping and the location information. Next slide. So there's a blow up of the mapping. We did a test call today from the new site. So the location, 50 Grandinetti Drive, plots it on the map for you. Scroll down to something. Gives you the latitude, longitude. It gives you the what 3 words, and we'll get into that in a second here. And it gives you a search radius. So it's saying within that 80 feet plot, that's where this caller is located. And historical incidents at the bottom there, 55. Yeah, I call 911 a lot because I test it from my cell phone. That's why it's called 55 times. But I can click on that button and it would show me every time that this phone is activated 911. Next slide. So this is a blow up of the transcription. So you see that the dispatcher said, "Alan, what's the address of the emergency?" There was the caller's reply, "My brother's having trouble breathing. I think we need an ambulance." Call taker asks for the location again. Caller provides it, and then continue on with the interview. Scroll back up just a little bit, Tim.
This one?
Yeah, so the red star, that emergency data, that's where we can mine the phone for the emergency contact information and the health information if they click that button. The yellow star, that's the language element. If I can't understand this caller, I can select a language or just tell it, you tell me. It's the green star, that media button, that's where I send them an outbound link to send me photos, to send me video, whatever I'm asking for. We also use a product called I Am Responding. Fire departments use that for incident notifications. They'll receive a push app right to their phone as soon as we dispatch it. Use it for response coordination. As the firefighters go en route to their firehouse, they'll hit the app so you can see that the firefighters are moving. And we use it for text messaging on both the county level and the agency level. So the fire department can text their own members. We can text every fireman in the county if we want to. What 3 words? I touched on that before. That's a location service that we use. It's pretty unbelievable. It's app-based or web-based. So this company mapped the entire world in 10 by 10 foot squares. And they assigned a unique 3-word combination to every single square in the world. So we're currently sitting at roughly pound cube underlines. That's 3 words that they've assigned to this 10 by 10. So this is used for remote callers, injured hikers, actually some like parks and stuff. They're starting to put signs in their trails. It'll say what 3 words, because all the first responder has to do is we'll tell them to go to what 3 words, and we'll say, put in pound cube underlines, and the fire chief is looking at the exact location I called. It's highly accurate. Some systems out west, like helicopter systems that fight wildfires and stuff, that's all the dispatch information they get. The helicopter will be told to go to pound cube underlines, and they fly right to the fire. So we have that technology here too. And that's a plot of the what 3 words. So that's pound cube underlines. It shows roughly where we're at in 401 state.
Wow.
This is a new tool for us, Ask Rail. This is a hazmat tool that we onboarded. It's been available to emergency responders for a while now. They just made it available to Communication Center. Next slide. And it's not for the public. It's qualified personnel. Next slide. So it allows us to look up hazardous material information in the rail car. We can look up the entire contents, of the entire train, car by car. It provides us contact information for the railroad associated with the car, and other reference tools like the emergency response guide and placard information, stuff like that. Next tool. So this is what the dispatcher sees. This is the portal. So imagine the fire chief says, "Hey, tell me what car 1102 has in it." So that they punch in 1102, submit it, go ahead, next slide. And this is what they see. So it gives them the car information, the contents, the railroad information, emergency contacts. So we can see that this is 1102 is a loaded car, 203 pounds of petroleum crude oil. They can click on that placard and get ERG information. Next slide. So this is a look at the entire train. So imagine, if you will, the fire chief has a fire on 1113, and he says, "This is looking into 1114. Tell me what's in 1104. Next slide. Okay, 1114. So we can tell him there's 175 pounds of chlorine in the next car.
Not a good combination.
That's just some of the other information I asked for. That's the app. Next slide. This is our CAD system. So we have hazard, the store has my information in our CAD system. So this is a look at, you'll see the address is ADM milling. That red arrow is pointing to what we call the alerts box. There could be a public or a responder safety alert in there. The house indicates there's premise history there, but that glowing placard indicates that there's hazmat information there. Next slide. So if they click on that placard, this is what they see. So this is an LEP site. LEPC site. It tells them what is stored there, how much is stored there. There's the emergency contact radio. So that's all at the fingertips of all the. This is just our in-house intranet where we store more hazmat information. Next slide. Again, this was built for LEPC. That's why it's hazmat heavy. So the dispatchers can access the E-plan. Next slide. They click on that, the E-plan opens. The E-plan is like a central repository, if you will, of all the hazmat reporting sites that store hazmat information. That's all. That's Bubba's wheelhouse. That's not. Next slide. They can click on the ERG. Next slide. And the ERG will open up. They'll have full access to all of the ERG in digital format. So the ERG is all the hazmat information, the placard information, you know. Next slide. And they have access to our local LEPC data. Next one. We are charged with activating NY Alert when the county needs it, when the chairman wants it, when Bubba wants it. Next slide. So this NY Alert, I should explain, it's like the reverse 911. I mean, it's got a general notification aspect to it, but so that's a look at the dashboard the dispatcher sees. We have 29,859 contacts in there right now. There are all those contacts plotted on the map. So each one of those little yellow spots is an NY Alert subscriber in Columbia County. This is the dashboard that we send the alerts out from. So you'll see that there's the state of emergency that was sent out back in January. Next slide. And I just threw in a couple pictures of the new 911 center that we are very blessed to be in. So this is the new 911 center. We're active as of March 9th. Couple of the dispatchers working. So the 9-site center. We have the call taker dispatcher workstations and then a supervisor console. And that's our first tour in Iredell Fire Department. We do tours with any public safety agency that wants to come in. It's important that they come in and see what we do, and you know, the dialogue and the relationship is important. So we invite them all in. So that's Iredell Fire there right now. I think that should be it. Questions? Tried to run through it.
Very impressive.
19 minutes.
It's amazing.
I have one about, I am responding. I am a user of that.
Okay.
And, I know that other apps have the ability to take that transcribed information that the dispatchers are receiving and put that into I am responding so that responders can see things as they're changing. Like, the conversation between, say, our chief and 911, because some of us I'm out in Ankrum, our reception can be really poor. So there's many times we can't hear what's going on the radio. It's that's it.
Yeah.
So if we had the ability to see that and read it real quick, when we get there, okay, where are we at? What do we need? Do we need to change what we're bringing from the firehouse? That type of stuff.
Yeah.
If we can't hear Dave or whoever,
Yeah.
Is that possible on I am responding, or is it not something that's
It's possible, but it's a CAD interface that the county would have to purchase to do that. And then what happens is you set up it's called an SFTP site. I am responding sniffs our CAD data, pulls it out and pushes it to your app. So it's an interface that's available. I can talk to George Field about it. I am responding is his product. It's not ours, but I'd be happy to talk to him and see if he'd be interested in the CAD interface.
It'd be interesting to see how other, some of the other fire companies, if they would find that useful or
Yeah.
not.
I know Wentworth County uses the
Dutchess does.
and Dutchess does too.
Yeah.
I've seen it, but yeah, I can talk to George about it.
Thanks.
Yep.
Thank you for sharing. That was excellent presentation and great information. And I feel like our 911 is in wonderful hands. My question is about a piece that I didn't know about as someone who potentially needs to call 911, and I have that droid that you don't know how to do it. But the idea of putting in my emergency contact or allergies or those sorts of things, could you or someone within the department potentially find out how to do it with an Android and then create a press release / poster that we as supervisors can hang up around our towns to let people know? Because I think that's a great thing and I want to do it and I want other people to know that they can do it and they might not know.
Yeah.
So just something that like even the QR code for iPhone, QR code for Android, brings you to where you need to do it, or instructions or something.
Yep.
For us lay people, that's very easy to follow.
Yep.
The non-tech
That's a good idea.
savvy people.
Non-techies.
What
Yeah.
is I have certain contacts that are labeled ICE in case of emergency. So if someone grabbed my phone, they could, search for that and then those people would come up. That's one thing. That's like a
And
total
maybe
back end.
bypassing your screen lock too, like allowing those contacts. and
Make
information
emergency
to come up
call, you
without
can
knowing your
call
staff.
you can call your ICE from an emergency call.
Yeah.
Great, thank you.
No problem.
Any other questions on the?
A couple.
Go ahead.
So in an active shooter.
Yep.
As an active shooter, does it automatically go down to all the police agencies or does it go down to just a few police agencies?
Well,
I mean, how does that work out? Does it?
it's treated as any other emergency is. What we do is we poll for the closest available patrol. But once that car is assigned or identified, then everyone hears it and everyone's gonna go to it.
So it's automatic to go.
Yeah.
So the second question to that part, are they all cross-trained? In other words, are these police agencies like the sheriff's department, the troopers, local police, whatever? I mean, have they ever had any training where they go into a school or into this, how that all works? Just asking that question.
Sheriff?
We have, and there's another one, the tabletop scheduled at Ichabod Crane, I believe in May. The last one we did was at Taconic Hill.
Okay.
And then we also, response, there's a response guy that
Yeah, that's right.
everyone got together. 911, sheriff's office, state police, lots of police, everybody, fire coordinator, EMS coordinator, everybody got together. And we have a basic response guide that, we finalized and sent out to all the agencies.
So what you're saying is it comes into the center, they dispatch the closest unit they can. Once they get on the scene, then the word goes out,
Everything.
it's going, it's
And
happening.
before,
Active shooter on the radio, you're getting every call.
Right. They're all- So the other thing when we had a thing in Clover at one time, some of the questions are for the firemen this time around. So when you get a fire called into your office, say there's a building fire,
Mhm.
does the fire company that's in that district go there first to inspect the fire before they call for backup, or does mutual aid come in automatically on something, even though they don't know what's going on
It depends on the district.
there?
The
Okay.
vast majority have pre-planned response assignments that authorize us to send mutual aid right off the rip. So in some areas of the county, you'll get 6 fire departments on the first dispatch. Others, there are some that go alone, but that's becoming less and less.
Okay, I just wondered that, because yeah, we had an issue with the same thing. First fire company got there, they didn't even have the right apparatus to fight it. By the time the other ones got there, it was already fully involved.
Yeah.
You know, so.
It all
it's like,
depends on the fire department.
Okay,
But I would say most for something like that,
would be mutual.
yeah, most have mutual aid on a structure.
You don't make that call.
No, I don't.
And am I understanding that if you're a supervisor of a town, not that you have discretion over the fire company, where it is a potential, doesn't call everyone, you would go to your local fire company and start that conversation to
Exactly.
see if they were open to changing.
I can't compare it. There's been times where a fire department has assigned mutual aid or not, and it kind of scratched my head, but I can't, it's not my wheelhouse.
And not that we can either, but again, we might have relationships with
Right,
our
you would
local
talk,
fire.
yeah, no, I was just wondering if it was mandatory, yeah, there was a set motion that that's what happened, like the police, our back would go to a house and fire and we send a bunch of people down there. Yeah, stuff like that.
It's the permit.
This question, okay, that's something we can look into.
Mhm.
That's it, Kevin, that's the only one.
Oh, yeah?
For now.
Somebody else?
Sure.
Done.
Kelly, can we be available, the slide deck be made available to us?
Is that-
Is there already?
There's no reason it can't be.
Second, I think the Ask Rail is fantastic. It was the first time I've heard of it. We have obviously in Chatham a lot of concerns with the railroad right next to
Yeah.
the school system. I'm sure we're not the exclusive owner of that kind of scenario, so
Yeah.
it's a truly beautiful app. I'm so glad to hear you developed it. And also kudos to the Yankton supervisor for being a sponsorship to work with it.
Yeah, I know, it makes me feel a lot better in Germantown, having the rail
Yeah.
run down along the river. It's like, oh, great. Something happens, you know what's on the train.
If it's for news, you have to
And I
call.
shouldn't just say the school system, as well as the higher density areas. but-
Yeah. No, it's a good tool.
So informative, right?
Very informative presentation. I thank you very much. So,
And I think we're supposed to say congratulations on your 30th, it's the 30th
30th,
year.
yeah.
Oh, okay.
oh, congratulations.
Is that happening?
And I've been there 20 years.
Time
You started
flies.
when you were a baby. You were two.
You started there the same time I started mine. Current employer, so long
Time
time.
flies when you're having fun.
Yeah, and you enjoy your
That's
job.
not what you tell me half the time.
So he has always.
All right, and you, while we have you up here, we do have a resolution.
Oh, I think that's staff's job.
Yeah, we talked about this before. I have a motion.
Second.
I have a second. Ray, you didn't even get on the action. on this
He's
one.
sleeping over there.
All in favor?
Aye.
Opposed? Carried. When you ask for money, how easy that is when you have to speak, you know?
Well, that's just all right. There's nothing that I really need to address. All right.
Okay. Thank you.
All right, thank you. I appreciate it.
Anybody have any further questions? Thank you, sir. All right, next up, we have District Attorney. Afternoon, sir.
Afternoon.
Chris, you should do a presentation on your own.
I didn't bring one with me.
Yeah,
not
today.
today.
Next month. That's your assignment for next month.
In the future. when
We
you-
did I did actually put out a 2025 year in review, which is available, I think, on our website. It certainly was available through our Facebook, but yeah, we have that available for your review if you'd like to see it.
Yeah.
Great.
Yeah, you have to check that out just for.
Yeah, it just goes over, our staffing, it goes over the types of cases we've done, the kinds of resolutions we've been getting, and the kind of stuff that I intend to have available on a data dashboard in real time for people to see what we're doing.
Interesting.
But today, I think I just have the request to fill the confidential administrator spot. Unfortunately, Zach is not with my office anymore, and I need to fill that spot.
Second.
I have a motion and a second. All in favor?
Aye.
Any opposed? Carried.
Sorry to hear about Zach.
Yeah, these things happen. Can I raise one thing that's not on the agenda?
Absolutely.
Which is that, this is why I need to fill this confidential administrator position, because it would be on the agenda if I had one. Which is that I was at the 325, building group meeting the other day. And there was a couple weeks ago, and there's discussion about their desire to have, an active shooter presentation at some point. And I guess I wasn't around. I guess there was something very bad that happened, maybe, I don't know how long ago.
Yes, there was.
That created a lot of chaos, I would say, right? So they were hoping to reopen that conversation and not necessarily to have a live fire type drill, but instead maybe a tabletop or something like that. And I said I would certainly support that. I think it's a good idea.
Dan discussed it with us at the last.
Okay.
Yeah.
He raised it too. Okay, yeah. Great. That's all I had.
Nice. Thank you.
Thank you for your time.
Thank you. All right, next up, fire coordinator. Not here. I don't think so. So the only resolution was to accept the resignation of Colin Brown from the hazardous materials team. Due to his time availability, the strengths can no longer meet the participation and training requirements.
Second.
A motion and a second, all in favor?
Aye.
Opposed? Carried. Sheriff,
Hello, everyone.
how are you this afternoon?
Wonderful. No, I can see my lawn. It's no snow.
Well, I can see, you can see the mud.
Yeah.
It's anything like my lawn.
Yeah, I have a white bedspread. The dog's been on it. We'd like to fill a criminal investigator position, and that's due to Travis Van Alstyne being promoted to senior investigator, so that opened up an investigator spot.
Move it.
Second.
Have a motion and a second, all in favor?
Aye.
Opposed? Carried.
The next one, the next two,
I was gonna say you got two, right?
yeah, are to fill two deputy sheriff's positions, due to two resignations.
Motion and a second, all in favor?
Aye.
Opposed? Carried.
The next is to fill a corporal's position in the jail. We had one gentleman take a voluntary demotion for hours to be with his family and that kind of stuff. So
Second.
Have a motion and a second, all in favor?
Aye.
Opposed? Carried.
the next are for AEDs. About half of our units right now have AEDs. in the cars, the marked units. And so this is so we could have one in each marked unit. And it's out and patrolling. God forbid somebody forget to grab something or to, there's a bunch of stuff that they have to get and put in the car. So this would allow us to equip every vehicle with an AED.
Move it.
Second.
Have a motion and a second. All in favor?
Aye.
Opposed? Carried.
And the next is to amend the budget for the, because of restructuring, this is the courthouse thing. So we're gonna, I think it's 1.5. Chairman, I think we agree on 1.5
1.5.
reduction in the budget.
Yeah.
Questions? Get a motion?
So that gets us to 350
Yes.
for this year.
This is the meeting that we had.
Yeah.
On the list.
Have a second?
Second, sorry.
Have a second? All in favor?
Aye.
Opposed? Carried.
And this one is a conference. We'd like to send two of our people to a conference. It's a Tremble Forensics Conference. And for those of you who don't know what a Tremble is, it's basically a digital tool that we use for accident reconstruction. We can map out buildings. We can do a number of things with it so that we can effectuate our responses.
I have a motion and a second. All in favor?
Aye.
There's sign response. Oh, yeah, right where it says sign here, right? I know you do. I'm gonna share it. I look right over that sign.
And then lastly is our out-of-county inmate report. We are, well, we're actually not too bad from where we were last year. The difference is about 3,000, which is still far below where we used to be. And our current population is 32 incarcerated individuals. 4 of those are from Greene County, 2 from Franklin County, females, because they don't have facilities for their females. And then for reimbursement, Greene County is now paying us what the other counties pay us. They were paying us 75, everybody else was paying us 90. So after a little back and forth, they're paying us 90. Yeah. They threatened to take up. I said, okay.
Send them somewhere else, right?
Absolutely. But that is it.
Thank you, Sheriff.
Any
Thank you.
questions for the sheriff?
Yeah.
Yes.
Just my congratulations to Travis Van Alstine on
Yeah.
his ascension. He's a top-notch individual.
He's a great guy.
Ready to
Yes, he
stay
is.
with us and involved in that.
Thank you. Lucky to have him.
Thanks, Sheriff.
You're welcome.
Right, next up, conflict attorney.
Hello, everybody.
Good afternoon.
So we are just seeking to fill we've lost one part-time conflict defender, and we're just seeking to replace that.
Move it. Second.
Motion and a second. You guys are fighting here. All in favor?
Aye.
Opposed? Carried.
Thank you.
Any questions?
Did you have the emergency?
Yeah.
Yeah, it has emergency fill. I have to sign that too.
Have it.
The mortgage.
Mark, you can give it to Cammy to send to them.
Well, you can have the top.
You have the person? Yeah. Okay. So when she does the 426, MSD 426 to fill it, that needs to be attached.
Got it. Although I think she already sent it over, but it didn't-
Did she?
Yeah.
It didn't have the,
Yeah.
authority to do it, so.
Okay. Did you send it?
It
I
does
think
now.
she walked it over.
That was just a pre-off.
Yeah, exactly. Just get him.
Just paperwork.
Just
Thank
take
you all.
Thank you. Next up, we have emergency management. Afternoon, sir.
I do have my green on.
There you go.
I probably should have some orange because I'm not Roman Catholic, so. I don't have a lot to report. We did have another major snowstorm, which the state declared a state of emergency. We didn't really have a lot of issues with it, and we've been really very lucky with power outages. The most power outages we had was actually last night so far this year, which was probably about between 16 and 1800, depending on what time of day. And it was 96 side, but mostly in the Ghent, Fabric, Belmont, Chatham area. Yeah. Yeah.
But compared to
And,
those Dutchess County numbers. it was
Yeah,
not
I saw that on the news. It's like, boy, Columbia County looks like they're great.
Even though, that seems like a lot, it really isn't. compared to everybody else and what they went through. To talk a little bit about the active shooter, we routinely do active shooter exercises. We've done it with all the school districts. Our next one is with Ichabod Crane, which we're in the planning session for now. I was not an employee or any way affiliated with the county when there was that one at 325 happened. Although I have been asked about that, and that should be a tabletop exercise, because to do a full scale exercise, meaning a physical one, you'd have to shut it down and whatever. Tabletop exercise, when we facilitate it, we bring in everybody that would, in all reality, could respond to it. So we can have, for example, the Ichabod Crane School, there's 16 agencies that are invited from the state all the way through to whatever other agency would respond. Local government, we routinely respond. They're important to have in the command post. When those things happen, we may need town resources, maybe highway trucks to block roadways or whatever. So that's something that we do routinely, and the county does have a good response plan. And it's not just for active shooter now, it's for violent incidents. And so, anything could happen, and this plan would help the response. Rail stuff, luckily along the river, you don't have hazardous materials. You have some recyclables that go through when no passenger trains are going through late at night. And they said once in a while propane, but I don't think that's
Mostly on the other side of the river.
yeah. But you will have in the near future, so we're told by Amtrak and CSX people, is that the engines coming out of the city for the passenger trains are going to have a battery car right behind the engine. That's because they're going to be required to go not using any fossil fuel at all until they reach a certain point outside of the city. So they're kind of planning for that, and they're immediately, but it is going to happen at some point in the future. So I've already talked to the fire coordinator about it. It's something, we may have to deal with if there's an accident or for some reason it catches on fire. As we have thousands of people that go up and down the rails every day. So, and then our activity report, if you have any questions.
Yeah.
Yes, sir. You always have good questions.
Well, I'm gonna do this, Jack, but I didn't want to hold her up. So I'm back to the active shooter because I'm involved with some things with that. And so what I understand now, and the active shooter, what didn't happen in Texas at one time, which we all saw on the news, that England, right now, it's first one's there, they go to the shooter.
It's always been
automatic.
that. It's always been that.
It's always been that.
The active shooter training started in the early 2000s. The very first one I attended, which was in Dutchess County, the very first training, and all the unoccupied GM buildings down there. It's always been taught that way, at least in New York State.
Just go.
You go to where the shooting is and you don't stop until you neutralize the person, whether that's taking the person into custody or otherwise neutralizing them. We learn from every single one, and we do read the reports from every single one because they've changed. One of the things that's changed recently in the last year and a half is that they found, because the training was always law enforcement goes to the shooting and goes to where the shooting is and was, and they had to step over victims. That's what they're trained to do. They're still trained to do that. However, victims were bleeding out. People that were alive were bleeding out. And to address that, now they have warm zones. So there's still officers going to stop that, because if they're shooting and that's going on, people are dying, they're getting hurt. But as more officers get there, they're forming a warm zone. So even though that isn't taken care of yet, they'll set up a security zone where firefighters and EMS can go in, do a very quick assessment, and then bring them out so they can treat them. And that's part of where the Stop the Bleed, that all came from, originally. So they're making changes as it goes. In Columbia County, the schools are very serious about, and they always have been. And we've started that back when Senator Steve Salan gave us money to put the, automatic door openers that 911 can still activate in the schools so that, law enforcement can get in the doors when everybody's locked down.
Yeah, I attended, we did the one in Germantown a few years ago. and
Yeah,
it was-
we've done it with every district. It's
Every-
just like
every
everybody, we haven't done in a long time. We've done, actually with Germantown, we've done, full scale in the past. We've done it with the college. We've done, it's not any different to do it with a county building. You know, in all reality, because you don't have everybody involved. You have to have the policymakers and the trainers involved and the decision makers in the tabletop exercise, so they can go back and change their policies and, you know, work on, training everybody else. But, yeah, it's, our school districts have taken it very seriously, so.
So I noticed in the event in Michigan, shooter in Michigan last week, was the nursery, the school, the synagogue, the whole thing. But they had a call system set up, so the teachers in the classrooms were calling the class parent. And that class parent then had a phone tree that went out to the other parents and said, don't come to the school, go to X. And by the way, Johnny, Jill, and Susie are okay. And so they knew, the parents knew immediately that the kids were okay and where to go off-site. Does our plan include anything like that?
Ours wouldn't, the
The
schools,
school
the
would?
schools are, you know, there's a lot of vendors out there that offer certain things. And the school, I think every district is different on how they want to handle it, that type, but they do have more communication with all their people. And I'm not saying with families, I'm sure they do. A lot of them have systems now, but I'm not sure exactly how they would handle that.
The parents were just so grateful that they'd been notified that their kids were okay. And they knew where to go and not to disrupt operations on site, to go someplace off-site.
No, it sounds like a
Something
really
that
really
the
good
schools
thing.
might consider.
Our concern with that is obviously is that we can't have, and we've seen it happen in the last year and a half in other states. You have parents that go right to the school and you're gonna, parents, grandparents, you're not just gonna get the mother and father. You're gonna get everybody and they're gonna go there and they create more chaos and it's more people that law enforcement has to worry about. So part of our plan is they're not gonna be able to get close, and Questar got a grant and they came up really state of the art, you know, other counties, have copied the plan that our Questar, program has put together, reunification. They're a first call in our process because we're then gonna be able to tell parents, this is where you go. You're not gonna get to the school.
Right.
This is where you go. And, you know, then we make sure that we have people there to, give them, updated information. You know, because the school in all reality is gonna be locked down for hours.
Right, and also not to have hundreds of people in cars jamming the roads,
Yeah, yeah.
getting in the way.
That was a big problem.
Right.
And we see some places, that didn't plan well enough for that. And, you know, one of the most recent ones had that happen. People are standing around and there where everything's happening.
I have another question, Bubba. I'm sorry, everybody. But this is actually,
You met your quota. I'm sorry.
If I was gonna be up here that long, I would have sat down.
I know you would have. Anyway, this is for everybody, because we're looking for information. We have a lot of proposals coming into our town for battery parks. Okay, so we've had a moratorium now for a year and a half on it. Just extend it, but we're running out of time. We have to make a
What do they
decision.
want?
Those battery parks, they call it, storage built battery.
Oh,
storage things. And of course, we're right, because we have these stations that they can hook into right away and stuff like that. So we're trying to get information. So I'm asking, has anybody gotten any information? Like I said, the state was updating the regs on these parks, especially for the firemen, to know what goes on, how they fight fires and these things and whatever. We can't seem to get all the information we're trying to get to make a decision on this, you know.
I think they're better off than they were.
They are, and they come up with new regs, but we haven't got a copy of that
I think
either.
they're better off, and I think the fire service is better off. I know the fire coordinator has, the ability now for smaller, like cell phones and things that start on fire, you know, smaller battery kits, and this probably isn't weird, but they have the ability now to, put them in a bag, a special bag.
Yeah, no, these are these big tractor trailers full of batteries or storage batteries, and
Yeah,
what they
they're
do is they storage it like on off time, and then in peak time, they put the electricity back into. That's the newest thing. And
Tractor and trailers?
they're
They put 'em in
like tractor
shipping
trailer
containers.
box, shipping
Oh.
containers. But they're designed, you know, if there's a fire in there and they're all hooked together, who goes in and fights these guys?
Do we have any in our county?
Not yet, but they're coming.
Yeah. they're
Just, that's what I'm saying. I'm bringing it up in case anybody gets the
That's
information. Give it
gotta
to us.
be-
We're trying to get all we can.
If somebody has that, or it's at a certain location, the fire service has to know about it.
Mm-hmm.
Whatever regulation comes out, or oversight, or, policy, it has to be that the fire chief has to know, and the fire coordinator, they have to know it's there. Because, this battery, I mean, they're already coming out with different batteries other than lithium.
Oh, I know.
I mean, they're just gonna keep coming out with different stuff, and it's coming out faster than the ability to, do fire protection.
The problem is we just found out because by law, we can't stop it. If
Oh,
we,
really?
if we pass a law that said we don't want them in our town, that's not gonna work.
You
Like, so
can, you
it's
can
like-
tell 'em, you can regulate.
We
it.
can regulate it, but we can't sit there and physically stop it. The state says
I'm
no.
glad you brought it up, because I hadn't really heard, I kind of read something about it, not that it was to the point where, it was, people were actually doing it.
Yeah, for my town it is because I have those stations, substations for electricity. That's what they gotta look into.
Okay.
So they gotta dump it. So down where we are, we got a couple of them. So we're getting hit a lot on, but we've held them off as long as we can. Now we're running out of time, so.
Huh.
Okay, if anybody thinks of anything, let me know. Appreciate it. Sorry to hold you
Our
all up.
local law is prohibiting battery storage systems above what the facility itself requires should they lose power.
But they,
And I know that's really minimalistic and that could be
Right.
challenged, but if you're worried about it, you can tell them to pump water uphill. Right? That's the best way to do it. And that's that overnight power generation. That's what they used to do at least. But
I mean, it's like everything else. This is for the country. And that's what they tell us. So we can't deny them. We put some regulations against it that doesn't allow, but it's not gonna work. Because the state asked Mr. Kopech down there. They know exactly what we're going through. They come on board. So anyway, thank you, Bob. I didn't.
Just one other thing too, is that, that in the school, security and active shooter, the sheriff's office plays a big part of that. I know that Sheriff Salvatore's, has been involved in that, the school resource officer and, the rest of that type of, security that goes on is, I think it's a primary issue in our county. And even the state police, but they don't provide the resource officers. They used to a long time ago in the beginning, but so, the sheriff's office is the main agency involved in that, and they do a really good job.
Thanks. Thank you, sir. All right, next up, we have probation.
I'm gonna end this very quickly. This will be the 2025 annual report from probation. As you review it, we kind of emphasized on trends, 3-year trends. We have new judges, kind of how that affects the supervision of people put on probation and other things. And I'll be back next month if you have any questions. Feel free.
Oh, you're looking at me, Ralphie.
If you got questions. I know you're still.
Gary's full of questions
They're giving me an evil eye over there.
You're still.
He must have nothing on his
I know, it's
agenda.
not just pretty pictures.
I know. I'll get back to you.
Pretty,
You got good colors. It's good.
you know. So, thank you.
Thank you. Before we adjourn, I'd like to, happily introduce the new 18B coordinator, Kyle Patzwall. He starts the position on, March 23rd. And, happy to be in the interview process with him. Very qualified individual, and I think he's going to serve the community very well.
Thank you very much.
Good luck.
And if nobody has any, are there any questions from the committee?
Kippy.
Kippy?
Yeah.
Well.
Kippy would like to make a motion.
Yeah. Are there any questions from the public? With that, I will entertain a motion to adjourn.
You got it.
Second.
Second, all in favor?
Bye.
Thank you, everyone.
nice job.